So this is an example or a model of a spine. And as far as we're concerned, for the purposes of this discussion, there are three major segments to the spine. The cervical spine, the 7 vertebrae at the top, that's 1, 2, 3, 4, 5, 6, and 7. And then the thoracic spine, which is the spine related to your chest, which has the ribs attached to it. That's 12 vertebrae. And then you have the lumbar spine at the bottom, which are these 5 vertebrae, 1, 2, 3, 4, and 5. Now, if you imagine, let's say, let's talk about evolution for a second. We evolved as 4-legged beings, if you believe in that kind of thing. And each disc takes the weight of itself and only the tissue surrounding it. The moment you make it an upright being, the disc takes the weight of itself and everything on top of it. So the lowest disc bears the most weight. Also, if you consider that this segment has a large amount of motion in it, this is an anatomical feature of the lumbar spine. There's a lot of movement of the lumbar spine. The thoracic spine, for example, is tethered to the ribs. It doesn't move much. The cervical spine, again, has a lot of movement in it. And surprise, surprise, the most frequent problems that people have are in the lumbar spine and the cervical spine. And as expected, the lowest disc, the L5S1, is one of the first ones to go if you do have a problem. So this is the lumbar spine, this is the thoracic spine, and that's the cervical spine. And in the cervical spine and the lumbar spine, you have the highest frequency of problems.